and welcome to the Queen Elizabeth Patient Podcast. I'm at the Proto Building today. I'm here with Emma Atkinson. She's one of our resident dietitian at the Queen Elizabeth. You've been a dietitian with us for over 12 years now, and you specialise in oncology with a lot of the different tumour sites. You've done previous podcasts before, but today we're kind of looking at more of the weight loss associated when patients are diagnosed and going through the cancer journey. So we'll start off by just saying, why do you think nutrition's so important in oncology?
So nutrition is important in oncology in order to provide us with the essential vitamins, minerals and other nutrients such as energy and protein that we need. And it's really important that we receive or that we take adequate energy and protein in our diet to help us avoid any unintentional weight loss or malnutrition, particularly where patients have a reduction in their appetite and oral intake. Nutrition is also really important to help us to maintain our energy levels and strength, to reduce risk of infection, promote recovery after surgery, but also in terms of promoting food enjoyment and quality of life.
Emma, you probably find that some patients will lose weight and realise that, the trousers feel a little bit looser and maybe their energy levels are getting a bit lower and they're jumping on the scales and they can't understand why, the scales are showing that they've had quite a substantial weight loss. Do you feel like there's any specific part of the journey when they would maybe start to notice that?
So we can start at all stages in the cancer journey, and for some people they might notice that they're losing weight, and that can be a sign and that can be what prompts them to go to a GP. So some people can lose weight even before diagnosis. Other patients can lose weight maybe when they start having treatment. You have all the side effects from treatment that can really impact on the oral intake. So everyone's different, and I would say at all stages in the cancer journey, potentially people can lose weight. And I think that can be due to the cancer itself or the illness itself. It can be due to the effects of the treatment and the side effects that they can cause. But also I think cancer has such an emotional impact that I think all of the worry and the anxiety that goes with that and with the treatment and with everything that person is going through can impact upon the weight, and often people say that they can lose weight with that as well.
So when you are you may be constantly worried about things, does that actually consume energy?
Yeah, I think it impacts on appetite as well, because I think when people worry they don't maybe want to eat or they're not eating as much, and that in itself can cause weight loss. And then I think you have some cancers based on where they are in the body can affect our absorption of food as well. So even if patients are eating adequate amounts of diet, for some patients they might not be digesting it properly and getting the most from the food. And for some people it can be a combination of things. So it can be the worry and the anxiety, it can be the impact of the cancer itself, and then it can be further impacted by the treatment, all of which just add up and make it, it can cause like a considerable weight loss.
Yeah. So how, if somebody starts to notice these things in their, like I say, in their clothes and the scales, and maybe family members are starting to kind of comment that you've lost weight, how can you maybe adapt your diet? Or if you're experiencing poor appetite, how can you maybe encourage to maybe eat a little bit more when you don't want to?
So from when I speak to patients, this is where they're always really shocked by the advice that we give, because I think traditionally people think that dietitians only advise people about healthy eating and telling people to eat less, but actually if you're losing weight and your appetite is poor, you actually need the opposite of that. So we would recommend a high calorie, high protein diet just to ensure that they're getting enough energy and enough protein in what they're eating. And a really good way is to try and eat little and often, because often a big meal is overfacing. Or patients just simply can't manage big portions, so having 5 or 6 little portions across the day can be much more appealing. And what we do recommend is fortifying food to enrich it, so making sure that the little amounts of food that people are eating are really as high in calories as possible. So it's adding extra butter to food, extra cream, extra cheese, things like that. The really important part of a high calorie, high protein diet is to make sure that they're having regular amounts of protein across the day. So high protein foods can include things such as meat, fish, cheese, eggs, beans, nuts, lentils, tofu, things such as that. But also things such as milky puddings can be really a good way to supplement a patient's diet, particularly if they don't feel like having a big meal. Sometimes even having a milky pudding is better than not having anything at all. But we recommend having full fat food, so buying everything full fat, so full fat milk for example. Choosing, I think, like any favourite or fancied foods to try and promote that appetite. So if there's anything that you fancy, trying to include that. And sometimes I think where appetite is really poor, it's trying to adapt food so that it's easier to eat. So sometimes people find like softer foods are a bit easier to eat, or patients might prefer cold options if they really feel put off by like a hot meal. So it's maybe trying to adapt food a little bit so that it's more appealing.
Because I can imagine for some patients going through maybe cancer of the throat or the esophagus or any sort of oral cancer in the mouth, things like the soft foods, but like you were saying, high calories, and would you sort of advise maybe a lot of like organisation, you maybe sitting down with a family member and looking at shopping lists and trying to encourage, like you say, things that you like, but, has it got the calories?
Definitely, and I think where patients need to adapt the textures, sometimes you need to think a bit how you can adapt meals, and I think planning ahead is really good, even if you've got a family member, to make things in bulk and freeze small portions so that actually you don't have to keep, especially if you're modifying textures or you're having fatigue and things, you don't have to keep making meals from scratch at every meal. You've got some meals there that, particularly where I think patients' likes and dislikes can change on a daily basis. So by preparing ahead, it means you've always got things there that you can maybe defrost and cook thoroughly so that you've always got something at hand. But I think some patients as well, that even following a high calorie diet can still lose weight, and there is what we call nutritional supplement drinks that we prescribe. So I think it's worth being aware that you may need referred to a dietitian and asking for that referral at an early point so that we can get these supplements and really try and optimise nutritional intake. And I think particularly where patients have pre-existing health conditions that they're trying to balance, or renal disease or diabetes, or they might have had surgery and have a stoma for example, or they might have swallowing problems or problems absorbing the food, that's when you really need the extra support and referral to a dietitian.
Would you maybe, if they went to see a dietitian, would they then go onto a prescription? And would they all be prescribed?
They would be prescribed, and they would be under the care of the dietitian, because often we prescribe the supplements, but it's then a case of monitoring. And because sometimes when we review patients, either reduce their prescription if they're doing really well, or for some it might be that we need to keep increasing the prescription or trying different products. So we continually review patients and adjust the prescription as needed.
I know that my mother-in-law, she had esophageal cancer, and she found it difficult. Some of the drinks weren't to her like, and so we used to have a blender and maybe blend it with other things, just to sweeten it up with maybe some frozen fruit or some sort of ice cream or something like that. So you get the nutrients from the juices or the yogurts, but a little bit of what she likes as well. Because I suppose it's about still wanting to enjoy the food.
Definitely, and I think you can make even ordinary drinks are really good. So like you say with a blender, you can get full fat milk, you can put loads of ice cream in, some milkshake flavouring to make like a really thick milkshake, or you can add, like you say, frozen fruit and lots of milk. You can put cream, ice cream in, so you can make it to your own taste for something that you like. Even having like hot chocolate and with full fat milk, and you can put cream on the top with marshmallows and chocolate, things that, creamy coffees. A lot of people like Horlicks and Ovaltine made with full fat milk, so things like that. And I think it's like you say, it's important to have things that you enjoy, because I think if you enjoy food, you're more likely to want to eat more of it versus having something that you don't like. And I think sometimes food enjoyment can be lost or reduced through the cancer journey, and I think it's finding ways to optimise that and really try and get that enjoyment back a little bit.
And you talked about maybe, like I say, avoiding the larger meals and the stacking. Is there any sort of particular sort of like high protein, high calorie snacks that you would you'd want to see on a shopping list, that's quite handy to have in? Is there anything particular?
So often if people don't have much appetite, like a small high protein snack would be great. So that would be things like, for example, crackers with loads of butter on, extra thick, with some cheese on the top. Some patients that have taste changes like to put a bit of chutney or something on as well that they can taste. Anything with pastry is really good. So often you can get like little sort of picnicky party type food in the shop, so little mini sausage rolls, little mini pieces of quiche. That could be great as little snack, little pork pies, anything like that is great. Anything like I mentioned, the quiche, because that gets the eggs in, which is full of protein as well. Nuts are great. Often, they're full of protein, full of fibre as well. So a handful of nuts would be a really good snack. So anything like that would be great as a snack.
With working in the breast cancer field, I talk a lot to the chemo patients. About having things in the fridge, so it's not the cooking process that maybe puts you off eating, because I think sometimes that puts patients off.
Definitely. I think if you're tired, if people have a lot going on, I think the energy to actually cook food can be off-putting, and it can be often something that patients can't manage. But I think the smell of food can be off-putting as well, and even having the cold option sometimes is quite good, because you don't get that smell from from the cooking smell, and it's a bit easier to eat small little light things that don't have that smell, that are going to be a bit better tolerated in terms of the nausea.
Yeah, that's great. And you sometimes, we see a lot in the media and things, that there's a lot of conflict and pressure with regards to different diets and what we should be eating. What would you kind of advise with regards to that?
I think it's looking at reputable sources. So I think you see a lot of things in the news, on the internet, and I think it's so easily accessible now, but I think it's just being aware that not everything that you read in the papers or online is always correct. So it's always making sure that there's evidence behind the recommendation, and it's trying to look for reputable sources. So for example, Macmillan, Cancer Research UK, the British Dietetic Association, they would always have evidence-based information, so it's just being really careful at the sources that you're looking at, because as I say, not all of the information online is going to be correct, and it can be really misleading.
I know that Macmillan is a great site to use, and they've brought out their own cookbook, which is that patients can find in a lot of the Macmillan centres. We've got one at the QE, and a lot of the other hospitals will have one situated in their own trusts. There's a great book that's free for all patients going through this as well. And I've had a little look at some of the recipes. So things like that is a great source, isn't it?
Yeah, because at Macmillan, there's so much information on the website, and they can post out booklets, or you can download the information. They have the healthy eating leaflet, but for patients that are losing weight and struggling through treatment or with their appetite, they have an eating problems and cancer booklet, which is brilliant. It's got all that information in about coping with different side effects, about optimising your nutritional intake, and they've got, as you mentioned, the cookbook. So they've got loads of really good information that you could either get a posted copy, or you can have a look at it online. That's got loads of really useful information and tips.
And I suppose it's probably, again, about family members and carers wanting to support their loved ones. This is something that they could maybe have a little look into, so they know that they're on the right track. Like I say, there's a lot of information out there. I suppose it's just trying to find the right sources.
Yeah, definitely. And there's lots of different ways that family and carers can offer support, because I think when you have a cancer diagnosis, and when you're going through treatment and you've got so much going on, particularly when you're not able to eat as well, or you're losing weight, I think there can be lots of anxieties and emotions around food. And I think the really important thing is to try and talk to your loved one about what they're going through and about how they're feeling, because I think that can really help understand where that person's coming from, and it can help relieve a lot of those anxieties. I think as a carer or a family member, the one thing that, we've all been there where we've had a family member that's not well, and the one thing you want to do by instinct is to give food and help feed that person. And it can be really upsetting and difficult if the person that you're trying to help isn't able to eat, or the likes and dislikes might change on a daily basis. They might have eating problems, and it can be a really difficult time, and it can often create a lot of conflict between the individual and the family and the carers. But things that you can try is about not putting too much pressure on that person. So it's trying to offer encouragement without offering a lot of pressure. So you're trying to avoid arguments about food, trying to make meal times as relaxing as possible, creating a comfortable environment. And I think not forward planning meals too much, because I think there's a temptation to say, right, what do you want for lunch today, and then what do you want for tea, and then all you're thinking about is food. And for that person, if they don't feel like eating, it can become a burden. So like I mentioned, trying to have things made up in advance that are at hand, so that maybe an hour or so before a particular meal you can ask that person, what do you fancy, and you've got something at hand that you can maybe try and get. Trying to, if there's good and bad days with appetite, make the most of the good days, help with cooking, so that saves that person the energy and having to cope with the smell, which we mentioned can be off-putting. And I think involving that person about what they would like to eat, remembering the small portions, little and often. Sometimes finger food can be really good, that can be left out just to tempt, always offering food, it's there, reached at hand. And I think just talking openly about eating problems and offering that support is really important.
Because I think that's one of the big things, is that, it does become such a big focus between, a relative and their loved ones who's going through this. And like say the barriers just get higher and higher if that's just the primary focus all of the time, is how much food can we get into you. And I suppose, like I say, we'd nursed a mother-in-law with esophageal cancer, but she also had dementia, so didn't quite understand why it was so important to eat. And it was just an ongoing battle. And I think looking back now, like I say, it's kind of focusing on the days where she was good and kind of, okay, she's eating that amount. And on the days where she didn't want to eat, it's kind of, like I say, it's helping her to consume that energy, doing the washing, hanging the washing on the line and things like that as well.
What I would say as well is that I think often what I think people sometimes maybe don't realise is that that person knows that they need to eat, and they know what they need to do, what they need to eat, but it's sometimes so difficult to do it. I think if they have particular symptoms, they really don't feel well, even though they try the hardest, they might not be able to eat a full meal. And I think it's just realising that, and it's just taking that pressure away, and just, even if they eat something is better than nothing, even if it's a small amount. Because I think the more pressure that you put on someone, or the more that you push the food, it can become a pressure and a burden, and that can then, there can be more anxieties about food. It can make it even more difficult to eat, and I think it takes the enjoyment away. Whereas actually just encouraging that little portion, they're much better to have a small portion of something they enjoy than have, really try and have a big portion that they're really going to struggle with. And a really good example of that is I had a patient who once told me that their family had been given big portions, and the way he described it is, he said it's like being given a bucket of food filled to the top and given a teaspoon and being asked to eat it, and you know that you're not going to finish that bucket with that little teaspoon. And I've always remembered that, because I think you're much better to have that small portion that's realistic, that can be enjoyed, because they can always go back and get seconds, and they're more likely to eat more than they are if you give them that big portion or that bucket of food.
I suppose it goes back to what you were saying before about those high calorie snacks, and that not seeing it as a meal, it's just a graze throughout the day, I suppose, as well. And you see, incorporating it and making it fun, with the shopping lists, and really kind of focus on what they want, and what maybe not what we think should be going inside them.
What they want. And I think another important thing to see is that sometimes patients have they've maybe had heart problems or diabetes, and they might have eaten healthy for years. And I would just liaise if you've got a dietitian or a doctor or a specialist nurse, because it might be that depending on where they are in the cancer journey, that actually that can be relaxed, and the doctors can manage that medically, because often patients really might fancy a nice hot chocolate with a little chocolate bar, and actually if it's appropriate for them, then that would be absolutely fine to have, and the doctors can often be really happy just to monitor the diabetes, for example, or adjust medication and things. So I think it's just speaking with your health professional if you think that's appropriate.
Yes, I suppose, we deal with, like you say, all parts of the journey with the cancer, and maybe if somebody was palliative and maybe come to the end, things like relaxing the rules a little bit about their diabetes or their heart problems. It's quality over anything, isn't it? Quality of life. So, obviously, your role and advice will change throughout the cancer journey because you're dealing with patients of all tumour sites and all different parts of the journey. So would you say that, like you say, the advice changed? I suppose that's a great example, isn't it, about maybe if somebody who's end stages in comparison to somebody that was maybe preparing for treatment?
Yeah, definitely. So I think, it is a journey, and I think along that journey the needs of that person changes, and I think as the needs of that person changes, our intervention and our aims change as well as dietitians. So I think if you have someone, for example, who's having treatment, we might really push nutrition, push the supplements, so we can promote treatment response. As that journey progresses, for some patients who might not be having treatment, they might be in the stages of palliative care, we really focus a lot more on quality of life, on food enjoyment, and for example we might not check weight at that point. Our aims might change from looking at weight to focusing more on quality of life and food enjoyment. And I think it's really important just to ensure that we focus our intervention so that it's tailored to the individual's needs, because really what we want to try and do is meet those needs in the best way that we possibly can. So as you say, it is about adapting our intervention as that journey progresses.
And I suppose it's just a very personalised approach, isn't it? And just every patient will have a different need, different support systems in place, and different thoughts about what they perceive as a good diet. And I suppose the likes of yourself and the other dietitians, you're there to support, but there's a lot of other support in the community and within the hospital as well. So what would, I suppose we're just coming to the end of this now, but what would be advice if a patient or a family member was maybe struggling and needed a little bit more help? Where would your sort of advice be the first port of call?
So I would say, get a referral to a dietitian at an early stage. So you can ask your nurse, if you've got a specialist nurse, if you're at the chemotherapy unit, or if you've got a GP or a consultant, they can refer you on to the dietitian. Also, you can look on places like we mentioned, Macmillan. They've got some really fantastic booklets on nutrition, so have a look on there for some additional information as well. But I think definitely where you need that support is really trying to get the referral to the dietitian.
Oh, that's great. Oh, well, thank you so much today, Emma. It's been great, and again, you've got so much good advice and out there, and and signposting us to the right places, because it is so much out there. But thank you very much for coming. It's been a delight. Thank you.